Hello everyone and welcome back to my YouTube channel. If you're here for the first time, hi, my name is Busari Mulayo and I'm a registered nurse. On this channel, I film content related to nursing and healthcare, and in today's video, I am going to be talking about 8 qualities that will make you a good nurse. Now, these 8 qualities are not all the qualities that are going to make you a good nurse, because obviously there are a lot of qualities that a nurse should possess, but I believe these 8 can get you started, and they are very important qualities of a nurse. So let's get into the video. So the first quality is that you have to be very observant. Observation is one major quality a nurse must possess, because a lot of things are going to be happening around you. The patient, the relatives, your colleagues at work. You have to just be very observant so things will not pass you by, and a lot of people are going to be expecting you to report a lot of things about the condition of the patient, the relatives that came in, what was done, how, if the mood of the patient changed, what caused the mood of the patient to change, if the patient said anything. Like, you have to be very observant. Say for example, if you're attending to a suicidal patient, you have to be sure that the environment does not have any harmful substance or material around, like poison, knives, pens, or any even things as insignificant as ties that person can use to, like, probably choke and strangle themselves. Things like rope, wires should not be around. So these are some of the things that you should look out for when you're taking care of a suicidal patient, and it all boils down to being very observant. A patient could be sleeping, and you need to be sure that the patient is breathing well while sleeping, like the breaths are normal, the person is not gasping for breath, because people literally die in their sleep. So you have to be very observant. So observation is one quality that you must possess as a nurse. Number 2, you have to be ready to obey rules. Nursing is not the profession that is going to let you do just what you want, anytime you want, however you want. Even as a nursing student, you would already understand nursing is very big on rules. Like, nursing is a very disciplined profession. We are very big on ethics. So if you know that you're not the type of person that you cannot follow, you're the type of person that cannot follow rules or be obedient, like be under the management of other people, like your senior nurses, maybe you should reconsider your option, because there is no country, no continent that you're going to be working as a nurse and you will not have to follow rules. And one of my matrons would say that nursing is aligned to military. Like, there are some similarities between nursing and military, and after my 1.5 years of practicing in the hospital, I've been able to see some of these things. It may not come off as bullying, some people may see it as bullying, but most of the times that's not exactly what it is. It's just you following rules. Do you get? So you have to be obedient to be a good nurse. Number 3, you need good communication skills. Now, while working as a nurse, you will have to communicate with a lot of people from different ethnic groups, races, different socioeconomic class, different genders, different orientations, different religions, and you have to be able to communicate with them well. Some people will not even have the ability to communicate with words. Like, you may have to communicate with people that use sign language and all of that. So your communication skills must be top notch. You must know how to use words rightly. You must understand things like body language that may send off wrong messages to your patient. You must be polite. You must be a good listener. When it comes to communication, you must be a good listener, and you must know how to convey your opinions without insulting or coming off as being rude or lacking manners. Basically, that you have to understand communication skills, and you need to understand body languages, just like I said. So some patients may not want to say things out, like orally, possibly because of people around them, but they want to, like, give you a sign that they want to talk to you privately. So your communication skills should be top notch. Do you get? So that's another quality. Another thing that you would need as a nurse is tolerance. You have to be very tolerant. Now, most of the patients that you're going to be attending to as a nurse are going to be doing some things not intentionally. Take for example, you just cleaned up a patient that has urinary incontinence, and the patient still ends up peeing or wetting the bed and clothes. that may come off as tiring, annoying, because you just literally cleaned up that person, but the person did not do it intentionally. If you're not tolerant, you may become angry and may not discharge your duties properly. So being tolerant is one of the qualities you will need as a nurse, because you're going to be doing a lot of dirty and not so nice things on a daily basis. Do you get? So you just need to be tolerant. So before I move into the other qualities, if you're enjoying this video, please give it a thumbs up. If you're yet to subscribe to my channel, because what I do here mostly is about nursing and healthcare, please click on the subscribe button to join my YouTube family, and click on that bell icon so you get the notification whenever I post a new video. My videos are always amazing, thank you, even if I have to say so myself. And don't forget to follow me on my socials. I am on TikTok as well as Instagram, where I post funny as well as educative content for nursing students. Finally, if you want to join my Telegram group, possibly if you're nursing students, I'm going to leave the link to my Telegram group below in the description box below, sorry, so that you can be able to have access to my free webinars that I hold from time to time, and also get notifications from my programs and other things. So let's move on with other points in the video. Another quality you're going to need as a nurse is that you must be eager to learn. One thing about medicine generally, healthcare system generally, there are new things that are coming up every day. Like, people are constantly researching, looking for new cures, new medications, new ways to take care of patients, like evidence-based practice and all of that. So you have to be eager to learn and adapt to new system, new rules, new ways of attending to your patients. If you're just this person that likes to stick to how things, stick to the status quo, stick to how things have been done since the 1900s, and you still want to continue that in 21st century, that is not really going to work well. So as a nurse, you have to be eager to learn. Next, you have to be able to work under pressure. There's a lot of pressure that comes with nursing, especially if you are working in the emergency unit. You could be attending to a patient, you could be chatting, and the next thing you know, they are wheeling in 4 or 5 different patients with different conditions, probably from a road traffic accident. Some people are injured on their head, the other has a fracture, one is bleeding profusely, another one is screaming for pain. You're going to be working under pressure, and in that situation you have to be able to think fast, know the first patient to attend to, know what to do, know when to do it, know how to save time and do so many things, know who to call, who to report to, where to place the patient. You're going to have to be a very fast thinker in that kind of situation, and if you don't work well under pressure, you're not going to succeed at that. So working under pressure is one quality you're going to need as a nurse. Another quality you're going to need as a nurse is being assertive. You have to be very, very, very assertive, because the healthcare team consists of different professionals, and because you are very, very you're going to be very close to the patient. There's something called patient advocacy in nursing, because we are the closest to the patient. Basically, we talk to them more often than other healthcare professionals within the hospital. So we tend to know some of things about them. Like, they may tell us things that they will not necessarily tell other healthcare professionals because of our relationship with them. So in that case, if you're trying to advocate for your patient, you have to be very assertive. You're not supposed to be looking like a dummy. You're not supposed to be begging. You have to be able to state your facts. I'm not saying you should come off rude or fight, but you have to be very, very assertive. State your points, hit your foot on the ground, and let people know that this lady or this guy knows exactly what he or she is trying to say. Finally, I am going to say that as a nurse, you have to be very, very clean. Now, people are going to come up and say cleanliness is next to godliness, but for nursing, I would say cleanliness is next to not dying. Seriously, one thing about nursing is that you're going to be attending to different patients with different conditions. Some diseases and infections are communicable while others are not, and the last thing you want as a nurse is to take infections from the hospital to yourself and back home to your family, your husbands, your kids, your friends, your families, and start transmitting infections. You have to be very clean. So things like hand washing, proper disposal of your PPE, like not wearing your scrub outside the hospital, knowing how to pack your air, like being clean and making sure you're not carrying microorganisms from the hospital outside is one quality you're going to be needing as a nurse. If you want to see more of my videos on nursing, click on this playlist that is going to pop up on your screen right now. Don't forget to subscribe to my channel, follow my socials, and I'll see you in my next video.